But once again, my name is Cynthia Paul, and I am the Legislative Director for the Service Employees International Union here in Michigan, affectionately referred to as SEIU. And we represent 82,000 workers and their families here in the state of Michigan. We also represent more than 2 million across the country. And SEIU, along with other labor unions, have actually been dedicated and committed to, number one, improving healthcare quality, access, and controlling healthcare costs. Whether it be our 3 decades of involvement with the Michigan Consumer Healthcare Coalition, or the Michigan Healthcare Purchasers Coalition, and even the Economic Alliance. It was probably about 8 years ago that the Service Employees International Union, we decided to take a strong stance for healthcare for all, because there were too many people losing their healthcare, too many families without basic preventative care, and so we have been full tilt on this issue since then. It included being a very active participant in the ballot initiative that actually never made it to the ballot in 2008. It includes signing on to Congressman Conyers' bill as it gets reintroduced every 2 years. We've also had a major push for Obama because he actually was committed to reforming health care. And we would not have endorsed him except for that commitment. And we were also involved with the Divided We Fail campaign, which is a combination of labor and actually nonprofits, providers, and businesses that had the premise that something needed to be done with healthcare and reforming healthcare. Recently, we had a major push for the budget to make sure that it had language for healthcare reform in it, and that's there. So now what's going on is the markup, which I'm not quite sure how I stand on that, because I'm a little bit disappointed in some of the provisions I'm seeing coming out, as well as everyone else. But we also had a huge rally demanding health care for now. Actually, this past week, it was actually Wednesday and Thursday, we had a series of town hall meetings, lobby days, and we joined with other labor organizations, HCAN, ACORN, and a couple other organizations. And we're going to keep pushing this issue. If you want more information on what we're doing, please check out the State Council website, which is seiumi.org. We had multiple campaigns actually having people call what they call patch-through calls into their congressperson's office or their senator's office, and we'll be doing something very similar to that in the near future. Real quick, I want to say why this is so important now. Is Michigan, we are facing a huge economic crisis. Our unemployment rate has topped 14% for the month of May. Every day, thousands of family and workers lose their health care coverage, whether because their COBRA expires or they just can't afford to maintain a COBRA benefits. But every day, and this covers all sorts of the gamut of workers. This includes the janitors who clean the buildings down in Detroit. This includes the 178 sheriff deputies in Wayne County that were let go. This includes also probably a lot of correction officers that will soon be let go. And we absolutely need health care for now. So, thank you.